Okay.
Okay, today I'm going to go over the medical kits that all of our clinics have received because of our new policy. And there's an emergency response policy in which every clinic will receive an automatic external defibrillator and a medical kit. It's important that we try to put this kit in a safe place where everybody knows its location, along with any other emergency equipment. So this kit is designed to be used for adults. So if you have a need for a junior EpiPen or a junior Ambu bag, then to have it in the same location so all of your equipment is together. So when you receive your kit will be locked according to all of the zippers with this little orange seal. So daily we're going to have a log sheet that's going to be housed right here in the front of the clear pocket of this kit, where you're going to write down this seal number and your initials to say that the contents are safe and that no one has opened and broken the seal to the kit. So now I'm just going to go over some of the contents of the kit. In the pocket in the front of the kit, you have 3 pairs of gloves, and the gloves seem to look a little bit small. The air is all compressed though, so I do anticipate they're probably small gloves. You have your blood pressure cuff and your stethoscope. So you grab this kit, there's an emergency, they say someone's down in the lobby, someone's down in the patient room. You're going to call for help, have them call the emergency medical services, and grab your kit, grab your AED, and you're ready to go. This is our friend, has everything in it that we need to take care of the patient safely. The goal is to stabilize that patient, but not to have them in the office for too long. We want the emergency medical services to come so that they can fully, comprehensively take care of all of the patient's needs. This kit has no intravenous medications, only IM or subcutaneous medications in the kit, or oral medications. First, when you open the kit, you'll have, looks like a boy and a girl, eye shield here. You do have an eye wash kit. Something was to get in your eye. You have scissors and you have hypoallergenic tape. You have a compression bandage. You have small, medium, and large oropharyngeal airways. You have a thermal blanket. You may be familiar with this if you run marathons. They give you this thermal blanket usually after running a marathon. Just kind of keeps your body heat in. So just open it up and just wrap yourself with it. You have an adult dose EpiPen at 0.3. You're going to give that right in your thigh muscle. If you have a pediatric patient, the recommendation from the committee and with the emergency response policy, you're going to only give half of this 0.3 milligram dose, so 0.15. So if you have a patient who maybe is suffering from a low blood glucose level, you're going to give them this instant glucose gel into their mouth. It's 24 grams of glucose. Some of the kits, some of the clinics will have glucagon kits that you will need to purchase separately if you feel like that's a need in your clinic. You also have a tactile tourniquet here. You have gauze sponges here as well in the kit, and you also have another compression combat bandage. You have an Ambu bag that is housed here. I'm planning to come back to all of the clinics to do some mock emergency drills. This is an Ambu bag already put together. So when we come back, we'll just see how well we do and how quickly we can get your Ambu bag put together. If you're not familiar with doing that, of course we hope not to have to do that on a regular basis, and it's not so easy to put together when you're in an emergency situation. So we'll practice this when we have mock emergencies. You will not need oxygen with this. This is your bag valve mask. You're only going to compress air, and again the goal is to just stabilize that patient enough until they're able to be transported to the hospital. Medication wise, you have your albuterol inhaler. All medications will be given under provider's direction and discretion. You have 2 ammonia inhalants. There has been some recent literature about the ammonia inhalants and the adverse effect of the diarrhea immediately, that it causes, but the benefits do outweigh that diarrhea episode. So we are okay to still supply and to give the ammonia and use the ammonia inhalants if necessary. And then you have 2 full-strength aspirins. You have 2 25-milligram tablets of Benadryl, as well as Benadryl in a vial, and that's 50 milligrams per milliliter, and we can give that in the muscle. Your EpiPen in the muscle, as well as we have epinephrine ampules that you can give muscle or in the subcutaneous tissue. Back when I went to school, anything in an ampule we would use a filtered needle for. That doesn't seem to be the practice anymore. There are needles and syringes also in your kit, but they're not filtered, and that's okay. And then you also have Narcan in your kit. We suspect an overdose, we want to give Narcan, we can give that in the muscle. We've got some alcohol swabs, and we've got nitroglycerin spray. So all medications given under the direction of the provider. So already developed in your clinics, you may have seen this flyer, and this didn't print very well, but you have a flyer that goes over the roles of the front desk, really to clear out the lobby if the patient has an emergency episode in the lobby, to make sure that the family that maybe brought the patient is still with the patient, and to just make sure there's space so that we can take care of that patient, to print off the snapshot sheet, and to activate 911 and to get emergency medical help here. The clinicians, as well as the medical assistants, will grab this AED, they will grab the medical kit, and they will grab a provider to come to the emergency. And then the provider, the role is explained here as well, will stabilize that patient and give any medications. And then whoever records this emergency, there's a worksheet to record any medications that are given, when CPR was initiated. They will scan this form, get all the signatures that are needed, and upload this into the patient's chart, as well as make an emergency note about the episode that has occurred. In addition to this video, all of the front desk staff, as well as all of the clinical staff, will need to complete their HealthStream module that will be assigned. It goes over the roles, the policy, and there's a video that Banyan representatives have created. It's about a 5-minute video that goes over the contents of the kit in a little bit more detail, but it is, again, only 5 minutes. So on this flyer also, there's a QR code. If you have a QR reader on your phone, you might want to go ahead and watch that video. It says things like nitroglycerin is a vasodilator. It's an anti-anginal given if we suspect maybe a cardiac arrest. So a little brief information about the contents of the kit. And then after you listen to the PowerPoint, watch the video, you'll take a 5-question multiple choice quiz. You have unlimited attempts to pass that quiz at 80%. In addition to information about the medications in the kit, there are drug insert copies that I have copied from the kit contents, and we can actually place those as well in this clear pocket. If your provider needs more specific dosing instructions, we have the Lexicomp app on Citrix, and you can print off specific dosing guidelines for maybe the Benadryl or the Narcan based on their age. Thank you very much.